I'm Craig Israelite from the University of Pennsylvania, and I will be presenting preliminary data regarding the recovery curve from physical activity following primary knee arthroplasty using passively collected objective measures with a smartphone-based care management platform and smartwatch. Dr. Nelson and I would particularly like to thank our collaborators at Zimmer Biomet as well as Apple in development of a very important and crucial project. While there certainly has been significant progress in minimally invasive techniques, pain management, and computerized navigation, I think we all certainly agree that it is imperative that we assess our surgery's objective measurements to assess, particularly as we lead towards pay for performance and outcome measurements. The purpose of this study was to characterize the recovery of physical activity following knee arthroplasty measured by a smartphone-based care management platform, specifically recording step counts and flight counts defined as flights of stairs. This is a secondary analysis of a prospective multi-center longitudinal cohort study of the MyMobility platform. There were 367 subjects we are reporting on to date with minimal 3-month follow-up. Of those 367 enrollees, 214 had stairs in their home and were able to provide flight analysis. Assessment was performed preoperatively, 2 to 4 days postoperatively, and then at 1, 1.5, 3, and 6 months postoperatively. Data presented as mean, standard deviation, median, and interquartile range. We used a signed rank test to compare the population step counts across windows to compare the changes from one measurement window to the next. Lastly, a sub-study was conducted to evaluate the patients who returned to preoperative step count levels at 1 1/2 month. As expected, immediately postoperatively, step counts decreased dramatically. By 1 1/2 month, 50% of patients returned to preoperative step count levels. Improvements continued and leveled off beginning at 3 months. With respect to stairs, values obtained on those patients with stairs revealed a similar pattern, though delayed more so than step counts, with 64% of subjects returning to preoperative levels at 3 months, with leveling off at 6 months. In our sub-study of those that were able to return earlier to preoperative values for step or flight counts, we found no difference in age, sex, BMI, or preoperative knee. We plan to look at possible other factors as data accumulates. In conclusion, recovery curves are similar to those previously reported, and we believe this gives validity to our objective measurements. This platform allows for easy, objective, and reliable data collection in large populations. The information may help set goals and guide recovery following knee arthroplasties. As always, additional research is needed to identify factors associated with the inability to achieve postoperative recovery. Thank you for your attention.